Columbia lawmaker is pushing for a bill that would require universities and colleges to have opioid overdose rescue kits available for public use on campuses. Thanks for joining us tonight on ABC 17 News. I'm Megan Drakis. Lucas has the night off. Our ABC 17's Mitchell Kaminsky joins us live from the University of Missouri's campus tonight. Mitch, the bill would require colleges and universities to have items such as naloxone nasal spray in visible and highly traveled areas on campus.
Megan, the bill was proposed by State Representative Doug Mann, who testified before the Missouri House Higher Education Committee on Wednesday. He says that the committee was mostly on board with the idea. However, he added that there were some questions about some of the language in the bill, which they're working to iron out. According to the Columbia Police Department, there were 13 deadly overdoses in Columbia last year. They added that there were also 20 suspected deadly overdoses. Representative Mann says a group of Mizzou students came to the Capitol to advocate for a variety of issues. One of the issues they were passionate about was making sure naloxone was readily available on campus.
I fully understand that, overdoses on campus are less likely than overdoses in other places in society. If this bill, if this law saves even one life, I think that the cost and the process is well worth it.
The University of Missouri is one of at least 18 colleges in the state with naloxone available. However, Mann says naloxone is typically located in places such as the health center.
So if you were to come upon someone who has overdose, the fact that those are far away can add a pretty significant amount of time to the ability to get that person those doses of naloxone. That lapse of time could be the difference between the person living and dying.
Mann says the bill would have naloxone kits placed in spots such as dormitories, student unions, or sporting venues. According to Mann, universities would have to cover the cost of the kits. However, he pointed out there are various ways universities can tap into funding at the federal, state, and local level to defer the cost. I asked numbers that show that overdoses are prevalent on college campuses. He was unable to provide any specific numbers. However, he said a decent number of people on college campuses report the use of recreational drugs or prescription drugs that are not being used for medical use, which oftentimes can be mixed with fentanyl. Reporting in Columbia, Mitchell Kaminsky, ABC 17 News.
Mitch, thank you. Now, one example Mann cited during this week's hearing was when 2 Ohio State students died in 2022 after taking Adderall that they didn't know was laced with fentanyl.